we're starting with the good stuff. I like it. What we learned was that of the patients that came to Origin, they had comparable outcomes across 3 different care settings. So virtual care, hybrid care, which is where we have patients who are doing both a plan of care that's virtual and in person, and then an in-person care settings. And then in person. I think one of the important things to point out here is that these patients were receiving 45-minute one-on-one sessions with the therapist. And I say that because not all virtual care is created equal, and also not all in-person care is created equal in terms of the time that you get with your patient and kind of what that looks like. But the important thing about this was that this paper observed that there was no signal that in-person care produced better outcomes than virtual. None. So, we've seen the benefits of virtual care in our practice for years at Origin, and we're just really excited to have this large data set that supports it. So this is really the first large-scale white paper of its kind, looking at retrospective outcomes across care delivery platforms. In addition, I want to be very clear that we truly delineated care delivery models here between virtual, hybrid, and in-person. Oftentimes when you read a study, it will say virtual, but when you actually get into the study and read it, they're describing what would be a hybrid plan of care, so that there is still some in-person component to it. So in our report, when we talk about virtual was truly virtual, and it was 45-minute sessions one-on-one with a physical therapist, which also matters because that time with the provider that was supervised was equal in all 3 care settings. And that's also, maybe not true for other physical therapy companies where you receive PT. So that needs to be taken into account, but that is our model. The outcome measure that we selected was the pelvic floor distress inventory 20. This particular outcome is a good choice for postpartum patients because it looks directly at 3 symptoms that postpartum patients often suffer from. So prolapse, urinary incontinence, and then bowel function. And our data set was very large. It absolutely included postpartum patients. I can't tell you the exact mix, but they were in there. And because we know that this outcome is very well suited for them, I think it would just be interesting to see, like, if we actually pulled some of those numbers out, might we see even more benefit from that patient population than we did larger mix, because of the inherent barriers that postpartum patients have just in accessing in-person care in that early postpartum period time.